So, lots that we can be doing to help prevent colds and coughs, which would be the most ideal thing, because but what happens if you actually go on and catch a cold? Sometimes it's unavoidable. What can we do in a homeopathic sense to shorten the blow of it all?
Well, as you said, remedies are highly individualised, so it's good to look at each case individually. But there are remedies that can be used for the first stages of flu, for example. I've got a remedy that I use in most cases for that. There are also some general combination remedies. I've got one called Age, and that covers a lot of flu symptoms, and that's
Not
a
aging.
combination. No, it's got gelsemium in it, and eupatorium, and arsenicum iodatum. So lots of big words there, but that covers most of the general symptoms of flu, like aches, chills, all of that kind of thing. So there are some general ones that you can use.
Now, I understand that you're running Orange Grove Clinic sort of surgeries.
I am. Yes.
So if someone wants to come along to those, and specifically to sort of find out about coughs and cold surgeries, when would they do that?
You can ring the Orange Grove, which is 01603 631 900, and reception there will book you an appointment with me. And with the coughs, colds and flu surgeries, it's great. You can come along and you can talk about preventative measures, or you can talk about your symptoms, your cough, your sore throat, your runny nose, your buzzing ears, you're just feeling what.
Are they at all different times then?
I'm there Tuesdays and Thursdays. So that's when you can book them, absolutely.
Okay. And is there much of a cost involved? Or?
The investment is £15, and for that you get 20 minutes consultation, and that will also include the homeopathic remedies, but not necessarily any other advice that I might give you.
Okay, sounds fascinating. Now, Rebecca, I've been calling you Rachel. I apologise for that. I just saw the word R and went for it. Rebecca Geanty, now you also work at the Orange Grove Clinic, and you're an acupuncturist.
Yes, that's right.
Needles.
Yes.
Lots of needles. How did you get into this?
Well, my old career was a restaurant manager, and I've been in the restaurant trade for about 18 years, and lots of hours, late nights, hard work, and I used to have lots of tension headaches. And I actually went to have some treatment for the tension headaches from acupuncture, and it sorted them, and also sort of made me realise about my own lifestyle. Having a more relaxed lifestyle would be great. So
in a way, similar to Kathy, you've both come into sort of therapy, such as homeopathy and acupuncture, through sort of quite tense, nervous lifestyles and tense, nervous headaches. But you've both come into that way. So
yes, that's right.
So again, I mean, what is acupuncture?
Well, it dates back, it's a very ancient therapy. It dates back to nearly 2,000 years ago. And what we do, we believe in Chinese medicine that you have meridians, which are like channels of energy that run through the body. And we stimulate these channels of energy by the use of acupuncture needles into specific points of the body. So when the body is disharmony, if there's illnesses or disease, then the channels of energy that run through the body are either stuck or there's not enough energy running through them. So we, balance that really with acupuncture needles.
So what can it help?
Absolutely. The list is endless. It's anything. The only thing we can't treat is haemophilia because of the clotting with the needles. The clotting of the blood is a problem. That's the only thing we can't treat. We get the list is really endless. It ranges from simple things, from coughs and colds, to I specialise in fertility and pregnancy, and also pain relief are some of the things it's very, very good for.
You mentioned pain relief. I mean, that's where I've heard acupuncture sort of used most in conjunction with. How would it block pain? I mean, is it all about sort of targeting, like you say, the right point in the meridian? Yes.
And, for example, I treated a patient last week who came in with sciatic pain.
Which is very, very painful.
Really painful, runs down your legs. So for me, I localise to see exactly where the pain starts from, and then we put the needles into the lower back in the most painful parts. Are very superficial. The needles don't go in, deep. It's just very superficial.
And they're not big, are they, needles?
No.
You've brought some with you, haven't
Yes,
you?
I've got some here. They're as thin as a hair. Would you like to see one?
I would like to see one. They look like they'd sew my jeans up. They don't look that thin.
That's there's like the head of the needle which we hold, which is slightly thicker, but these are very thin on the bottom.
I think, to be fair, they are thin. What was just alarming was the pack that they came in, because they looked like just something I find in my sewing kit.
Yes, I suppose.
That's what worried me slightly, but looking at them more closely, of course, yeah, they are very thin. And are you going to put one in me?
Would you like to have a go?
Oh, go on. I'll probably pass out, so apologies.
I would love to
24 minutes past 11 if suddenly there's complete dead air.
Okay. So shall I put a general one in for relaxation for you?
I'm on air, remember that.
Okay. Shall I come over to you?
Oh, God. Why am I doing this? Excuse the clonks.
Okay, so what you'll feel is just either a dull ache or a tingling, no pain sensation at all.
Are you sure?
Okay, yeah, I'm absolutely sure. So we'll just put one in here, which is a very good point for general relaxation, and also we use this point for coughs and colds too. Okay, so you just feel the pressure there of the guide tube, which deadens the nerves on the skin to give a very painless insertion. There you are. That's the needle in.
I didn't feel it at all, actually. Wow, that's amazing. I mean, I've probably sort of hurt myself more with, well, not hurt myself, but, you know, a bite would be worse, you know.
Yes, that's right. And so many people are so frightened, and it is, you know, of needles, and it is just a little tap and it's in.
And what apart from looking at this strange thing sticking out of my hand, which is now sort of moving a bit. Why is it moving?
Well, sometimes it can be connecting to or very close to some of the blood vessels that run through your body. So
dear. I didn't explain. I wasn't good with this stuff. Oh no, but it's tingling now.
Okay, good. That's a sensation that is often felt by people.
And what does that mean?
So it just means that the acupuncture is working. What we're really doing is talking to your body and allowing your body to heal itself. So there's nothing sort of weird or magical going on. We're connecting to very close to the pathways of the nerves.
Okay. I've got to use that hand in a minute to operate the
Would
mouse.
you like me to take it out? Okay, so we'll take it out.
Oh, wow.
There you are.
Oh, thank you.
You're very welcome.
As Rebecca makes her way slowly back across Studio A. Lots of clunks and clicks. But, yeah, that was amazing. So how many needles would you be putting into someone for a specific treatment?
Well, it varies. I mean, it's hugely variable. It could start... for something as simple like, let me think, for stress relief, we would start off probably very simple treatments like 2 or 4 needles maximum. Somebody with pain relief, a few more. So it really is so variable. It depends what you come in with.
So only 2 or 4 needles?
Yeah, it can be as simple as that, yeah.
Wow. And how long do they stay in for?
About 20 minutes to 45, depending on... you know, what you're coming in for as well in the diagnosis. And then other needles are just straight in and out.
Really?
Yeah.
I'm sort of, just because I've had a needle in, I suddenly feel, oh God, I could have loads more. So, and what can one feel after a session? Because I know that sometimes if you're put into a relaxed state, maybe you might feel sensations that you haven't felt before. And what would you be telling someone coming to see you?
Well, usually what people feel after treatment is a feeling of wellness, a feeling of calmness afterwards. If they come in for pain, quite often they can experience pain relief straight away after treatment. There's nothing, no bad symptoms that can happen after. So it's really just a positive response.